Hi, my name is Cindy Lai. I'm a personal trainer and fitness instructor, here to help you learn how to train smarter and move better. If you sit for long periods of time and you suffer from lower back pain, there's a lot of things that could be going on. Your psoas could be tight, your hips could be tight, your hamstrings. What you do day to day will affect all the activities you participate in, from running to walking to lifting to surfing to swimming. Whatever you do will be affected. Now, if you don't learn how to change some of those movement patterns over time, you might go into a lot of different issues and suffer from even bigger issues. So it's really important, whatever you do today, you learn to fix those movement patterns. Since I've been training using the Feldenkrais method, which is a movement technique which addresses how to fix movement patterns, I'm going to incorporate that into today's tutorial. So before doing anything, I want you to keep your feet planted on the ground. Your job is just to relax, let everything go. I just want you to take a couple of breaths in through your nose, and then exhale. Let everything out. And again, so deep breath in through your nose. As you lift, maybe lift up your chin, but very gently, and then exhale. Let everything tuck. So again, one more time, going up through your spine, lift, and then exhale. Release everything. If you missed my neck tutorial last week, we focused more on the neck. Today we're going to focus on the lower region, focusing a lot around your pelvis, your pubic bone, and how that can possibly unlock your back. So what you will need for today's lesson is a chair that's flat. I have my stool over here. You want to make sure the chair that you have, it doesn't dip, it's a flat surface. So what you want to do is, you want to sit comfortably, maybe come to about, a few inches forward. You want to make sure you're not like all the way back. And again, all I want you to do from here, I just want you to relax, okay? And just kind of just let your hips, your pelvis tilt forward. So if I'm grabbing your pelvis, this is what it's doing. You're going to tilt and tuck, okay? Just tilt and tuck. Just kind of let that go for a second. And then what you're going to do is I want you to lift your right side up. Right butt cheek comes off the chair, lower it back down, lift the left side up, come back down, and again. Just to kind of loosen up whatever's locked up today. Maybe you don't feel locked up, but this is always good to do, just to kind of loosen up. Right? When we're sitting for so long, it's like everything gets really tight. So if you're carrying stress, especially now, so many people have gotten laid off, so many people are taking bigger workloads, your body absorbs all that stress. So it's really important to kind of just let that go, because if you're constantly carrying that stress, it's going to exacerbate the issues you already have. Now, before doing anything, I just want you to rest your hands comfortably on top of your thighs. And all I want you to do is I want you to just look to the right, just nice and easy, look to the left. I want you to remember at the beginning of your lesson where your range of motion is on each side. Does one side feel tighter? Does one side feel more restricted? And the other thing is, when we're doing these movements, less is more. The idea is to do the opposite of what you normally do. We're not trying to stress, we're not trying to strain, we're not trying to push, we're trying to relax, and we're mobilizing in a different way, okay? And then all I want you to do is I just want you to lift your chin up, lower it back down. Again, see where your range of motion is, and breathe. Breathing is really important. So many people forget to breathe. Okay, so relax everything. So keep everything nice and just relax. I want you to try to sit up nice. So when I say sit up tall, I don't mean pushing your hips forward, okay? You don't want this to happen. Try to find neutral in your pelvis. So what you want to do is you're neither tucking or tilting. You're finding the middle ground between the two, all right? So what does that mean? If you place a hand flat on your stomach and on your back, it should be neutral, it should be flat. So relax everything. All I want you to do from here, we're going to initiate movement. So your spine consists of the lumbar region, which is your lower back, the thoracic region, which is the upper mid back, okay? And then the cervical spine, which is your neck. So this is all in your back. Okay, so we're going to focus right now just lifting, okay, from your lumbar region, your lower spine. So I want you to keep your back straight, okay? What you can do from here is you can place your hand, okay, right hand on your stomach if you're not sure, okay, what to do from there. And so all I want you to do from here, okay, place the other hand on top. I want you to lift from your lower ribs and just turn to the right. Somebody's calling you over your shoulder. How do you turn? So again, when you lift, you're going to turn. And again, we're not doing a lot of reps. All I want you to do from here is just nice and easy, turn. See where your range of motion is, okay? No cranking of your neck. Can you learn how to turn from your lower ribs? And the idea is also rest as needed. So just because I'm guiding you through it, I'm walking you through the exercise so your brain can kind of understand it, rest as you need to, all right? Now, what I want you to do from here, keep your hands back to the original position in front of your thighs. And again, just turn to the right. Again. Somebody's calling you to the right, turn to the left. See if anything changed. So the idea of these movements is to go nice and easy. Absolutely no strain. Good, come back to center. Now we're gonna do the same thing on the left side. So again, you can place the same hand over the same, okay, doesn't matter. So this time I want you to lift, okay, from your lower region, okay, lower ribs. You're gonna turn to the left. And I want you to breathe. And then exhale, turn to the left. I want you to pay attention to what's going on in your lower body. What happens when you turn to the left? What muscles, again, I don't want this to be muscular. What has to work in order to make that happen? Do you feel that your left side is contracted as you turn to the left and your right side elongates? Good, relax for a second, place your hands down, and you turn to the right, turn to the left. Good, do you feel any difference? Good, relax that, let that go for a second. So again, if you want to lift, okay, right side, butt comes off, left side. This might feel good for you to like every time in between just to loosen that up, because if you hold on to this is not good for your back either. And again, you want to tuck and tilt if that feels good for your lower back. I would encourage you to do that in between just to kind of just loosen everything up. Any one posture for a long period of time is never good, whether you're standing or you're sitting, because your body carries itself in a certain position. And then it could acclimate into bad posture, you know, especially if you have injuries or if you carry your shoulder on one side, if you carry all your stress on the other side, if your body's overcompensating, you know, something to keep in mind, all right? So now what I want you to do, okay, we're gonna do the same thing, all right, but we're going to turn, we're going to initiate from our upper spine, mid to upper spine. So if you're not sure where that is, okay, I would encourage you to place your hands underneath your sternum. So right now, just like when you're initiating, I want you to think about initiating through the middle of your spine, the rib cage, okay? Let your body follow naturally, okay? Then what I want you to do is I want you to place your left hand down. So this time, okay, as you turn to the right, you're going to place the right arm behind your head. So again, no tension in that shoulder. If this does not feel comfortable for you, you're going to place the right hand across your left shoulder. Okay, so again, sitting into neutral position. So as you turn to the right, initiate from that upper spine, that mid back, and then come back to center. And again, deep breath, and then exhale, look over your right. So does that left arm want to slide forward so you can get more length? Okay, and again, rest as needed. So inhale, and then as you exhale, as that left arm slides forward, does your right hip go back to allow you to turn? So what does that mean? Like, does that right side pull in? Exhale, reach. Good, relax for a second. So what's happening to my legs, right? If I turn to the right, like pretend these are my legs, right? The right side has to pull in back so that the left side can elongate. All right, so pay attention to also like what are your feet doing, right? So as you're turning to the right, your right heel is pulling in as your left foot, okay, goes forward. Okay, so now let's test that out again. So turning to the right and turning to the left. Does anything feel different? Good, relax for a second. Let's do the other side. So placing the left hand behind the head, okay, right arm goes forward. Okay, so again, keep everything relaxed. So again, option, place the left hand across the right shoulder if that doesn't feel good. Take a deep breath as you exhale, turning from the ribs. Think about here, you're turning left. So again, maybe that left hip, okay, pulls in. Breathe, relax. And again, deep breath, exhale. As you're turning to the left, maybe that right side wants to go forward, okay? Think about the tension on the floor. So again, not creating tension, just where does your legs, the weight, where do you feel the weight in your feet? Okay, so again, your hips, okay, sit bones down, okay, left side's pulling in, right side is elongating. Think about the way your entire spine moves. Exhale, reach. Good, relax for a second, shake everything out. So again, you can lift one side, other side, tuck and tilt. These are things that you should be doing every day if you're sitting, besides getting up every 20, 30 minutes, besides everything else, you know, you shouldn't stay in one posture for too long. Not good for your back. Okay, so this time you're gonna turn to the right, turn to the left. And again, see how you feel. Do you feel a little bit looser? All right, shake everything out. If you lift your chin up. Does everything feel more fluid and more smooth with the way you move? All right, so this is a really short lesson. We're going to go over this in my class tomorrow, my mobility class on Sundays. What I would do is I would encourage you every day to focus on mobility in these small ranges of movement where it feels good for your body. From the moment you wake up, okay, you're not going to go hard in the beginning. You're going to ease into your movements. So on top of what you do every day, how you carry yourself, that greatly impacts all the activities you participate in. So on top of that, posture exercises, corrective exercises. You also need to balance out your training regimen with the right program, because if you're doing what everybody else is doing and it's not great for you, what's the point of that? You don't want to get injured down the road, especially if you already have injuries. It's really important, really be mindful. You have to retrain your brain, because your brain tells your nervous system, you know, it can relieve stress in your nervous system, but it's also understanding how your body is supposed to move. If you want to improve your movement quality, okay, and your quality of life, this is something I definitely suggest that you try it out. Please let me know, please comment to let me know how it goes. Thank you again for joining me. I look forward to seeing you in my mobility class on Sundays at 12 p.m. Eastern Standard Time. Have a great one and stay healthy. Thank you.